students, I am Dr. Ramya Sree, your OBG mentor. I am here at DBMC at Calicut. So what are the high yielding tips which I can give for making your OBG a perfect subject? So first and foremost, concentrate on the core concepts. See, it's not just important for you to learn amenorrhea or answer the questions of amenorrhea. No, I want you to understand the core concepts. So go through the core concepts first, like reproductive physiology. Why is all this happening? So once your core concepts are good, then the outcome of your result will be more better. Second, every diseases, wherever possible, try to read the pathophysiology perfect. For example, if we see PCOS. So in PCOS, what is the pathophysiology? When you understand the pathophysiology, why is there theca cell hypertrophy? Why is there increased estrogen? So you automatically understand what is the treatment. So everywhere concentrate the pathophysiology. So these are the first point which I am telling you. So make your core concepts perfect, understand the pathophysiology of the diseases, automatically management will be known to you, right? Next up, when you think whatever topics, whichever high yield I have given to you, in that practice as many questions as possible. The more you practice the questions, the more perfect you become. For questions, utilize all past 5 years question papers of NEET, INI-CET, UPSC. Use all these 5 years question papers, then you will definitely become perfect, right? Now, you have the only difficult part in the OBG is your oncology. For oncology, sit with your friends and pure study can enhance difficult topics. So whichever you feel are very difficult topics, either sit with your friends or you teach somebody else. When you teach, your concepts also become better, and that way you reinforce that entire topic in a better way, right? And one more thing for gynec, simplest way is once understand embryology and reproductive physiology. Then go through other topics like amenorrhea, infertility, contraception. All these are the same version of the basic knowledge of reproductive physiology as well as the embryology. So for gynec, reinforce these topics. That's how you can make OBG. You can score very well in OBG when your concepts are well. Thank you. So now, what are the most important topics which you should know in obstetrics and gynecology? So in obstetrics, you have to be perfect with the maternal adaptation in pregnancy and antenatal care. That's a basic topic, but you tend to get so many questions from there. In amniotic fluid disorders, just remember the causes. Most of the time they ask you causes, right? Next, labor you have to mainly know the timings because that's highly volatile. The rate of dilatation, the rate of descent, what is second stage. So those timings you should be knowing in the labor chapter. Antepartum hemorrhage is very important. Postpartum hemorrhage is very important, right? Miscarriage, ectopic, these are also extremely important. Next, you also have preeclampsia, which is many times asked. So these are like highly important topics, and recent times you're getting questions on instrumental delivery, right? One thing also I would like you to look is infections like micro you also have. So torch infections, just go through that topic also, it's important. So next, coming to the gynec, amenorrhea, extremely important. You tend to get so many questions from amenorrhea. Infections, again infections is very important, that is vaginitis, ulcers, right? And oncology with cervical cancer. These are some extreme important topics which you should definitely revise. Thank you so much guys. Happy studying.